Hello lovely viewers, welcome back again to my channel. This is your midwife Bella. If you are new here, kindly like, share and subscribe. We are treating pregnancy-induced hypertension today. Stay tuned for more. Hello guys, welcome back. We are still on the topic pregnancy-induced hypertension. Now, what is pregnancy-induced hypertension? Pregnancy-induced hypertension is a form of high blood pressure in pregnancy. It occurs in about 7 to 10% of all pregnancies. Another type of high blood pressure is chronic hypertension. That's high blood pressure that is present before pregnancy begins. Pregnancy-induced hypertension is also called toxemia or preeclampsia. It occurs most often in young women with a first pregnancy. It is more common in twin pregnancies and in women who had pregnancy-induced hypertension in a previous pregnancy. Usually, there are 3 primary characteristics of this condition, including the following: high blood pressure, a blood pressure reading higher than 140/90, or a significant increase in one or both pressures. 2. Protein in the urine. 3. Edema or swelling. Eclampsia is a severe form of pregnancy-induced hypertension. Women with eclampsia have seizures resulting from the condition. Now, HELLP syndrome is a complication of severe preeclampsia or eclampsia. HELLP syndrome is a group of physical changes including the breakdown of red blood cells, changes in the liver, and low platelets. That's cells found in the blood that are needed to help the blood to clot in order to control bleeding. Now, what causes pregnancy-induced hypertension? The cause of pregnancy-induced hypertension is unknown. Some conditions may increase the risk of developing pregnancy-induced hypertension, including the following: 1. Pre-existing hypertension, that's high blood pressure. 2. Kidney disease. 3. Diabetes. 4. Pregnancy-induced hypertension with a previous pregnancy. 5. Mother's age younger than 20 or older than 40 years. Now, 6. Multiple fetuses, that's twins or triplets. Now, why is pregnancy-induced hypertension a concern? Now, with high blood pressure, there is an increase in the resistance of blood vessels. This may hinder blood flow in many different organ systems in an expected manner, including the liver, kidneys, brain, uterus, and placenta. There are other problems that may develop as a result of pregnancy-induced hypertension. That's placenta abruptio, and it means premature detachment of the placenta from the uterus. It may occur in some pregnancies. Pregnancy-induced hypertension can also lead to fetal problems, including intrauterine growth restriction, that means poor fetal growth, and stillbirth. If untreated, severe pregnancy-induced hypertension may cause dangerous seizures and even death in the mother and fetus. Because of this risk, it may be necessary for the baby to be delivered early, before 37 weeks gestation. What are the symptoms of pregnancy-induced hypertension? 1. Increased blood pressure. 2. Protein in urine. 3. Edema or swelling. 4. Sudden weight gain. 5. Visual changes such as blurred or double vision. 6. Nausea, vomiting. 7. Right-sided upper abdominal pain or pain around the stomach. 8. Urinating in small amounts. 9. Changes in liver or kidney function test. Now, how is pregnancy-induced hypertension diagnosed? 1. Blood pressure measurement. 2. Urine testing. 3. Assessment of edema. 4. Frequent weight measurement. 5. Eye examination to check for retinal changes. 6. Liver and kidney function test. 7. blood clotting test. How do you treat pregnancy-induced hypertension? 1. Your pregnancy, overall health and medical history. Extent of the disease. It depends on the extent of the disease. Your tolerance for specific medications or procedures. Expectation for the cause of the disease. Your opinion or preference. Now, the goal of treatments is to prevent the condition from becoming worse and to prevent it from causing other complications. Treatments for pregnancy-induced hypertension may include bed rest, either at home or in the hospital may be recommended. 2. Hospitalization, as specialized personnel and equipment may be necessary. 3. Magnesium sulfate or other antihypertensive medication. Now, 4. Fetal monitoring to check the health of the fetus when the mother has BP may include fetal movement counting. So with this, you keep track of the fetal kicks and movements. A change in the number or frequency may mean the fetus is under stress. Now, non-stress testing, a test that measures the fetal heart rate in response to the fetus movement. 3. Biophysical profile. This is a test that combines non-stress test with ultrasound to observe the fetus. Now, 4. Doppler flow studies. Type of ultrasound that uses sound waves to measure the flow of blood through a blood vessel. Continued laboratory testing or urine and blood for changes that may signal worsening of pregnancy-induced hypertension. Medication called corticosteroids that may help mature the lungs of the fetus. Lung immaturity is a major problem of premature babies. Delivery of the baby. If treatment do not control pregnancy-induced hypertension or if the fetus or mother is in danger, cesarean section may be recommended in some cases. Now, prevention of pregnancy-induced hypertension. Early identification of women at risk for pregnancy-induced hypertension may help prevent some complications of the disease. Education about the warning signs is also important because early recognition may help women receive treatment and prevent worsening of the disease. Thank you for listening. See you in the next video. Bye.